The government has asked the UK medicines regulator to formally assess the Pfizer-Biontech vaccine. If approved, it'll begin to be rolled out across the country from next month. It comes as official figures suggest that coronavirus infection rates are levelling off in England and Scotland and decreasing in Wales and Northern Ireland. The R number for the UK continues to fall and is now between 1 and 1.1. Our health editor Hugh Pym reports.
A flu jab today for a member of staff at a GP practice. Along with others in England, they'll soon offer free vaccinations to all patients aged 50 and over.
Sleeps up, please.
So a very busy few weeks ahead. But then there's the COVID vaccine as well, assuming it's approved. This doctor told me they're ready to start when given the word.
Well, there'll be huge logistics involved with that in terms of texting patients, writing to them, phoning them, which takes a lot of personnel. Obviously, the personnel actually to do the vaccinations. But we have done that already. We've done it with vaccination programmes for flu.
At today's Downing Street briefing, the Health Secretary set out more of the plans for the COVID vaccine rollout in England.
We will be ready to start the vaccination next month, with the bulk of the rollout in the new year. We're heading in the right direction, but there is still a long way to go. Coronavirus remains a grave danger right now.
So what is happening with the virus? The R number for the UK is down a little, but it's still just above 1, showing it's spreading. The Office for National Statistics survey for the week ending November the 14th says that in England, 1 in 80 people were estimated to have coronavirus, which was similar to last week. In Scotland, it was 1 in 155 and rates had levelled off. In Wales, it was 1 in 165, with rates decreasing over the past 2 weeks. In Northern Ireland, 1 in 135 had the virus, with rates decreasing over the most recent 4 weeks. Some of this may reflect different lockdown plans and timings. One expert says in England there are big regional variations.
It seems to be very much that the Northwest and Yorkshire are going down and almost everywhere else is going up, and some places going up quite quickly. And until we understand that or reverse that everywhere, I don't think we can say that lockdown is working.
So I've asked the NHS.
The Health Secretary said the data was promising and the second peak was flattening. He and others must decide what happens after full lockdown ends. How strict will restrictions have to be in England after December the 2nd, and over how many days might there be some relaxation during the Christmas season?
We still haven't made those decisions. Over Christmas, I know how important it is for people that we have a system in place, a set of rules that both keeps people safe but also allows people to see their loved ones.
Drive-through centres like this one in Greater Manchester are delivering the flu vaccine, but soon will come the much bigger task, with the hope of getting all adults vaccinated against COVID-19 by the spring. Hugh Pym, BBC News.